Good morning, everybody.
Good morning.
Good morning.
Welcome, bienvenido to our community. And on behalf of the more than 3,000 doctors and the over 1 million patients in the Somos network, and our fellow providers, medical staff, and the patients that they care for in clinics and offices all across New York, we are really honored and grateful that you are all here in this so important event for this community. Thank you.
Thank you.
Community doctors are the front lines. We are your eyes and ears. We are your partners. We know our communities, and we are the family doctors whom our patients, your constituent, trust the most. Our model means total care, multi-generational, patient-centered, physician-led. It means really preventive care, ensuring that the most vulnerable don't get sick in the first place, to drive up outcomes for our patients and drive down costs to all of you. The pandemic laid bare how vulnerable our communities are. We fought in the street for our patients for 2 years. Nos las pasamos peleando de todos los puntos de vista, haciendo testing, vacunando, dando comida. We fought in the street for our patients for 2 years, testing, vaccinating, feeding. Now, we're back in our mode, preventive care. That must extend to health delivery to all kinds, including mental health and behavioral health. We look forward to today's discussion with all of you on how to join together to meet the challenge on what is a deep-seated, long-term crisis that we're all committed to solving. As community doctors, we are uniquely suited to play a centralized role in delivering the mental health care services that are so sorely needed. We welcome our close collaborator, our governor, Kathy Hochul. La Kathy, la gobernadora. From the first day of her administration, Governor Hochul has made sure that community doctors were at the table. But before that, you should know, many times when we do a testing, nobody knows what was going on. She chose up to be with us on those testing sites through the city of New York. She has gone to our neighborhoods, listened to our doctors, talked to our patients. She has made it clear that she sees community doctors and that preventive care delivered by community doctors is essential to a strong and healthy New York. Her ambitious mental health agenda is a strong example of her vision and her values, and we look forward to working closely with her to bring more services to our communities where greater mental health access and equity are so much needed. Thank you for being here, Governor. We honor once again. Vamos a darle la bienvenida a nuestro secretario, el primer hispano secretario de Salud de los Estados Unidos. Y sin lugar a duda, un gran líder hispano de nuestro país. We were grateful that you chose this to be here not long ago, Pediatrics 2000, to receive your booster shot last fall, together with the Commissioner of Health of the City of New York.
Todavía lo siento, ¿eh?
It's protected. And you took time to meet with community doctors and to listen to us, learn about our national model of value-based care. I insist, value-based care, where people are accountable to be sure that results are happening in this poor neighborhood. And the essential worker people. It's a nice title. Let's be sure they get good results. Who live right here in our neighborhoods. With your support, we're able to best meet the moment and deliver on the promise of better, truly sustainable, culturally competent, accessible, equitable care in our neighborhoods. The Biden administration has made it clear that better mental health care in our country and the mental health equity and access are a serious priority and a strong commitment of his administration. When I mean administration, also include the wife of the second gentleman, our vice president. We hope, as a community doctors, to be at the table, and we are here in turn to support you. Come to us for what you need to make sure your vision becomes a reality. We are here to help. Estamos aquí 100% detrás de usted para ayudar en la agenda de salud mental y por eso estamos al lado en este momento, en esta comunidad que tanto ha sufrido y tanta gente murió durante esta pandemia. And we are beyond honored to have you here, Mr. Second Gentleman. The fact that you are here today speaks volumes about who you are and who the administration is. I don't remember this has happened. I would not expect that to happen in my lifetime. But you here, thank you. So much of the time, our communities are a second thought or fall through the cracks, but not with you. That you had chosen a clinic here in Harlem, Washington Heights, all this middle where the really people are in needs is important. This clinic is run by an immigrant that largely treats immigrants and says so much in what we are. Let me tell you, today, at this moment, or this week, ending today, we have 140 doctors in the Dominican Republic, in the countryside. They already get to the 25,000 patient visits, dental with all cover that we've been doing for the last 30 years in Dominican Republic. That's what he's doing here today. It is clear that you see us and that you are committed of the care and provide to our patients. Thank you for that. The work that the Biden administration has already done to make mental health more accessible to all is commendable. We look forward to working closely with you to provide better care to more people. And before I finish, I want to say thank you. Henry Munoz. I don't see him.
Henry, he's over there.
Let me tell you why. Why? When Henry was working with President Obama, I told him about my idea, how to change healthcare. And now being here designing and get communicator, we brought him here. I say, I don't know what the budget will be. We have to do magic because the message has to get up there about preventive care. And the pandemic hit, and here we are, educating, designing campaign, Marvel, to bring the kids to get the vaccine. I just saw that Pfizer's got the Marvel to be used. We've been doing that for the last 2 years. More than 12,000 kids got the vaccine because of that. Anything that is needed, thank you, Henry, for that. We are here to support you. We are the front. We are the back. We are the side in this community. Thank you for being here. Thank you.
Thank you, Doctor.
Dr. Ramon, you're also the heart of this community, and I want to thank you for the passion that you've brought to your life's calling, which is to help people in communities that for far too long were ignored, forgotten, overlooked. And by what you've done with Somos and teaming up with Henry Munoz and putting a spotlight on the needs of communities like this, and I saw you in action, you and Dr. Chen and hundreds of doctors and nurses all over this city, as you were literally saving lives, the testing sites, the vaccination sites. So I was in awe of you back then, but my esteem for you continues to grow as you're taking on new challenges, letting us have this conversation here to put a spotlight on mental health, something that for far too long was never discussed and open, the stigma, particularly in Latino communities, because people are proud, they're strong, they don't want to be asking for help. But with your credibility in this community, you've changed that dynamic, and for that, I applaud you. Dr. Ramon, thank you for all you've done. It is incredible to have The secretary here as well, we're former colleagues in Washington. He was rising up in leadership. I was a rookie member of Congress, but he still talked to me. He was a nice guy, a good person, and we developed a friendship that I thank him for his spotlight on these issues, but also what he has done for our country and particularly for the state of New York. So let's give another round of applause to Secretary Xavier Becerra. And I have a tremendous fondness for the second gentleman. I know the trials and tribulations of being that spouse, but to use his voice as he is able to, have the platform, and not just to go about his way, but to say, I have a voice that people will listen to when I show up, as he does today. It's a gathering of people who want to hear what he has to say because he's a very important voice in our nation, and I thank him. We are huge fans of Vice President Kamala Harris here in New York State. She's a dear friend. We love her, and as you do. But also, the Biden-Harris team is always welcome here in our state, and thank you for lending your credibility to this. This is something that's been important to me for a long time. I gathered here a number of years ago at Communal Life. We had a roundtable with young teenage girls, Latinas, and we talked about why the suicide rate is so high among these literally children. They're teenagers, 13, 14, 15. And a lot of it came from cultural stress that they're under. Their parents come from another country where there's maybe more religious restrictions and attire restrictions and all these things that made these girls feel different when they showed up in their own high schools or middle schools. And and teenage girls, it's hard enough. I was one, I raised one. I understand the psychology of teenage girls, but in this community, it's particularly hard. And that's why having the opportunity to have culturally sensitive and relevant professionals makes all the difference in the world, because they're more likely to open up, not just for mental health services, but all services, if they're being treated by someone who had a similar life experience. Maybe they're new Americans, their parents were new Americans, they're still finding their way in this country. Or those who just want to know someone speaks the language. How basic is that? You want to have someone understand what you're trying to describe to them. And so all these factors, they don't rise to the top always, but we need to talk about them. And part of my priority has been to find ways to support more people of color becoming healthcare professionals. We literally in November announced that we're going to forgive the loans of psychiatrists who studied, who are in the communities on the front lines, psychiatrists from black and brown communities, up to $120,000 for psychiatrists and $30,000 for nurses. That's how we're helping them find their way to these streets and these communities and not abandon perhaps where they came from because they're more lucrative jobs, so they have to figure out a way to pay their loans. We also are fully funding 1,000 scholarships for nurses every year. We started last year because our healthcare workforce was decimated by the pandemic. So many people put their lives on the line and were under siege, under stress, and it's unbearable what they had to endure, and some left. Some were sick, some literally passed away from contracting COVID on the job. So we have a severe shortage. And the way we need to approach this is to make sure that this is an opportunity for us as a state to literally fund some of these ways to get them the education and get them on the path so they can someday work for places like Somos. So we are very intentional about this. And the whole mental health crisis overall. I think psychologists someday will be studying what happened to the human condition during these 2 years of isolation and disruption. We know the effects on teenagers. We know that they've not recovered from this when they had 2 years, sometimes alone, fixated on the only connection they had, which is their social media network, and not getting a true learning environment, a nurturing environment, an environment where there's adults keeping an eye on them. So we're suffering the consequences. They're suffering the consequences, which is why I have put forth the largest investment in New York State's history to finally take mental health out of the shadows and put $1 billion behind it, and I'm hopeful to get that in my budget in the next couple of weeks. And we're just getting started. We truly are. And we're going to be conducting roundtables across the state. I'll make an announcement on this, how we're going to be gathering people. It's also about dealing with people who need treatment. We'll be proposing to have 1,000 new mental health beds, 3,500 units of supportive housing, because what has happened before, literally someone is on the streets, they're taken to an emergency room. There's not enough room, so they send them back, or they get 24 hours of care, and there's no place to discharge them to with long-term services that are going to actually change their lives, because otherwise they are right back on the street, and they're not getting the support they need. So we are focused on the continuum of care, the lifetime of care, but also in our schools, making sure that with the extraordinary amount of money that we are funding schools with this year, a record amount, that the schools take part of that money and literally have healthcare professionals in the schools so we can identify the signs, get treatment, work through the challenges of our young people so they don't need a lifetime of mental health services because we catch it early. These are the strategies we're employing at the state level. We have many, many more, but I want to hear from the panelists. But I am committed to this, heart and soul. I'm committed to this. Every single family in the state of New York has had some family member who either succumbed to drug overdose, as I have, or someone who's still dealing with mental health, and teenagers who are feeling that sense of isolation, and how are they ever going to get through this? And we as the adults and the policymakers and those who've committed their lives to public service, whether it's a doctor or a member of the community who stepped up in places like this great organization here, we're all part of this. We're part of the solution. But as our second gentleman has said, tackling our nation's mental health crisis starts by talking about it. And I want to thank him once again for bringing his voice to this conversation. And let me turn it over to our great second gentleman, Douglas Emhoff.
Thank you. Thank you. Thank you, Governor Hochul. Thank you for your leadership, your passion, and your friendship. It's been so great to get to really know you these past couple of years. And I get to see you not in front of all these cameras. We get to see you behind the scenes, doing the work for the people of New York, doing work for people of the United States. So thank you for that.
Thank you.
Dr. Ramon, thank you so much for having us. Thank you for what you're doing. Somos, Henry, I don't know where you are, Henry, but thank you for all you do, Henry. You're such a great leader on this issue and so many others. And thanks for having us. My good friend, I am a native New Yorker. I was actually born in New York City, in Brooklyn, and it's just so humbling to be back here as second gentleman in the place of my birth in this great city of New York to talk about mental health and do it with now my fellow Californian, the great Secretary Becerra, who actually, he was in Congress, and when my wife went from Attorney General to the United States Senate, this gentleman right here became the Attorney General of the great state of California. Now we are both working together in this administration on various issues that affect all of us here in New York and around the country. And we travel the country together. We do a lot of things together, important work that affects people in their everyday lives. And today, we're talking about this topic of mental health. And let's be clear. There is a mental health epidemic going on in our country right now, and we must change course, and that's what we're going to do with the Biden-Harris administration, and that's what Governor Hochul is going to do in New York. So we need to push back on this, and that's what we're going to do. 1 in 4 adults aged 18 or older, I think the number is probably more than that. A lot of it is not reported, and a lot of it's undiagnosed, and a lot of it, as the governor said, we don't even know what the effects of this pandemic are going to be for many years. But at least 1 in 4 has had a mental illness in the past year. And think about that. That's millions and millions and millions of people. And what are we going to do about it? We need to treat it. Young people in particular. You've seen the reports, you've seen the press. We certainly see it in the administration. Record high levels with young people. Violence, sadness, depression, desperation, and unfortunately, suicide and suicide risk. And this is especially true for young girls and women. It's devastating. We need to do something about it. And the social media, unchecked social media, misinformation, disinformation, meanness, all the things that we're seeing on social media affect, and how it affects our young people, especially young girls and women. You see it, it's everywhere. Excuse me. We have an amazing Surgeon General in this country, the other SG, Dr. Murthy. He has really been a champion and a leader on this issue of mental health, in particular mental health as it relates to youth. He put out a report on this in 2021. He is speaking about it. He and I have gone around the country talking about it. I have also seen it firsthand. I have traveled to over 30 states as second gentleman, and this is what I do. I meet with folks. I meet with mental health providers. I meet with activists, but I also meet with affected people, and I hear from them. And I take it back to the administration, and we turn that information into action. And it's really hard to figure this out sometimes. Sometimes it's right under your nose, and you don't even know what's happening as a parent. In fact, I was in Columbus, Ohio last year, having an event very similar to this, mental health as it relates to young people. One of the women who worked at the facility, a mental health professional, her own daughter tried to commit suicide. Didn't see the signs, didn't know what was happening, and she is a mental health professional. That's how insidious this is. Fortunately, her daughter survived, and in an act of real courage, mom and daughter have now gone out publicly to tell this story, so this won't happen, hopefully won't happen to others. I was in Maryland a few months ago talking about our great 988 program, which is a suicide crisis lifeline. So call 988 instead of 911 if you're having suicidal thoughts or suicidal ideation, 988. I went to one of these call centers, and I heard from a Latino individual who identifies as a member of the LGBTQI+ community and had been having suicidal thoughts. They were struggling with their own identity and their family's religious beliefs. They used the 988 line, spoke to a counselor who was trained and culturally competent. We talked about that. He was able to reach someone who was able to listen and got the help. And now they're working there at that same facility, helping others. So this is how this works. Dr. Ramon, you said it. The Latino community has faced barriers historically when it comes to mental health resources and accessing those resources. And that's only gotten more difficult. Suicide rates, unfortunately, have increased in the Latino community. And sometimes, unfortunately, it's harder for Latinos to access these services. And these services sometimes come with obstacles, such as language and cultural barriers. We've just talked about that. President Biden and my wife, the Vice President, they recognize these challenges persist. And that's why they and this administration are taking action. Tomorrow, believe it or not, marks the 2-year anniversary of the American Rescue Plan. $5 billion from the American Rescue Plan went to states and community organizations delivering mental health and substance abuse treatment. Just yesterday, President Biden proposed an historic budget that had historic investments in the behavioral health workforce, which, as the governor was saying, doctor was saying, we need more people in these workforces, especially focusing on youth mental health and mental health research. Individuals with private insurance would receive expanded coverage of mental health benefits and would be guaranteed an adequate network, one that is responsive to their needs. The proposed budget also ensures that 988, which again is saving lives, can address 100% of the estimated contacts and expands the CDC's suicide prevention program to all states, including DC and 18 tribal and territorial jurisdictions. 998 is currently working to open more Spanish language centers to ensure that language and culture are not barriers to someone who is desperately in need of help. Imagine what it takes to make that call. So you want to make sure you have someone there who can listen and help that person and save that person's life. My wife, the vice president, she's been taking action to raise mental health awareness her whole career, from her time in San Francisco as district attorney, attorney general, United States senator, and now as our vice president. She worked with kids who were suffering unbelievable trauma, and she put programs in place to help them. And that really informs her work now as vice president. And just like myself, the president, the first lady, she is also going all around the country, talking to people, listening to people, and taking back what she hears, especially on this issue of mental health, back to the administration and turning that into action. Biden-Harris administration is going to continue to do everything that we can to destigmatize mental illness. Part of the problem, as we know, has been that stigma and has prevented people from obtaining the life-saving treatment that they so desperately need. So the more people that can talk about it, the more people like myself and the secretary and the governor who are out here publicly talking about mental health and making sure people are okay to get treatment, making sure those folks' families and their communities and everyone around them is okay with them seeking treatment. And this administration is going to continue to work on this issue of providing money, providing resources, and breaking down these barriers so we can save lives. In short, President, the Vice President, this whole administration has your back. And with that, I'm going to turn it over to my very good friend, Secretary Becerra.
I thank the second gentleman. I'd like to begin, if I may, where so many things start, and that is with el Dr. Ramon Tallaj and everything that he has done over the years for this community. To you, to Henry Munoz, who helped spread Somos beyond New York, we are eternally grateful. Parece que lo único que falta aquí es la comida y el beber llorando, ¿verdad? Así que otherwise, it's complete. And we're looking forward to hearing from some of the professionals that have made life much better and saved lives here in New York City shortly. But to el doctor Tallaj, muchísimas gracias por saber dónde queda la familia. It is nice to be home with family every time I come and visit New York City, and you invite. To Governor Hochul, who I am fortunate to call friend before I call her governor, I simply say, thank you for the tremendous investment. Everyone says that a budget is a statement of your values. Madam Governor, we know where your values are. And the fact that you are here today when you need to be in Albany is a statement, again, of your values, of who you care about. So we are in tremendous debt to you for what you're going to do for not just the state of New York, but what happens in New York ripples out and happens everywhere else. And so thank you for your leadership for this country, not just for the state of New York. We appreciate that you are here as well. And to a good friend, the second gentleman, he probably out-travels the president, vice president, me, and everybody else combined. He is everywhere. The second gentleman has taken this on, and we are fortunate that he has, because we so much need voices out there. And I appreciate that anytime I ask, can you help me with this particular event to raise the profile, he's there. And it should be no surprise that today he finds himself here with us, with Somos, and once again raising the profile of an issue that everyone knows we need to talk about. You know, it's hard to say, especialmente con familia, but today the American family is saying, we're in a mental health crisis. 9 in 10 Americans today, if you ask them, say, America is experiencing a mental health crisis. no one can have any doubt that we need to do something about this. Here's the difficulty. In too many places around the country, it's hushed. It's still not discussed. Aguántate. That used to be the way we handled it when I was a kid, because one, you either didn't have access to health care, aguántate, you had no choice. Or because that was the culture, you eres fuerte. Especially for boys, niños no lloran. And so you hold it. Fortunately, I had a mom who gave me a better set of advice that I now always look at and work with. And she used to tell me, es mejor prevenir que remediar. Much better to prevent than to remediate. And so for me, everything I do, I try to make sure I prevent rather than try to fix it. Frederick Douglass, a great leader of this country, said it way back about 160 years ago, just as well. He said, it is easier to build strong children than to repair broken men. And so what we're about now, and that's where I think we all pay tribute to our president and vice president, they seem to understand, es mejor prevenir que remediar. We can build strong children now rather than spend so much money to try to fix broken men and women. And so we're fortunate at the Department of Health and Human Services that we have that chance to help build strong kids. And so that's what we intend to try to do. And for me, it's important because having learned the lesson from my mother, we need to move away from a healthcare system that focuses on illness care. You're sick? Okay, we're going to send you to the doctor. You're gravely sick? We'll send you to the hospital. We remediate, right? It's an illness care system. We wait till you're ill until we give you access to the best professionals who know how to keep you well. We should have a wellness care system that prevents. And so, when the second gentleman mentions 988, it's about getting you before you fall. The fact that if you're willing to call, in some case you're getting ready to take the wrong fork in the road and you are willing to make one last effort and you make that call, the last thing we want is for you to get a busy signal when you call. But here's the other thing that we're doing with the leadership of the president and the vice president. 988, if you call 988, as I said, in some corners of this country, sometimes it's a little too quiet, a little too hidden. You call 988, and if you say, necesito hablar con alguien, pero no hablo bien el inglés, you will get someone who will get you in Spanish. Yeah. Because we made sure with President Biden's commitment to 988 that we had the resources to stand up for the first time, call, text, and chat in Spanish as well as in English. And so today, if you're hurting, but you don't know how to communicate that in English, you can call and you will get a professional who will help you because of the commitments in this leadership in this federal government. And so it is important that we take those actions. And I want to conclude by mentioning two more things, because they're money, so they're more important than perhaps what I've said before. Today we are announcing that we're going to commit $15 million new dollars to our Minority Health Fellowship Program, which will help train up minority community members to go into the healthcare fields so that we can get more people working with Somos and the rest of our communities to provide that healthcare that we need, including the mental health services that we need. And the second announcement that President Biden and Vice President Harris have made possible for me to announce is that we are going to add $25 million in funding for school-based healthcare services so that we can expand access for our children where they are more than anywhere else perhaps in the day except home, and that is in the school, so they have access to the care. And here's the kicker. You want to apply for that money? You also have to make sure you're providing behavioral health services with the dollars at the school. So you can't just say it's to put a Band-Aid on the cut or to treat the broken finger. It now has to be to treat the broken heart and the mind that may be depressed. And so we're going to do what we can to add to that, because at the end of the day, I think we all took the lesson from Dr. Ramon really well. This is about family. Somos una familia. Tenemos que estar unidos. And I will tell you that at the Department of Health and Human Services, as with the Biden-Harris administration, we understand this American public, the people of this country, at the end of the day, somos una familia, and we have to help each other. And so we're ready. We're going to do what we can. And with the partnership of Governor Hochul here in New York, we know that we're going to make some great strides. So, Dr. Tayash, thank you very much for inviting me back again. Thank you very
En
much.
su casa.